Hello there. Today we're going to talk about lithium and its potential use for COVID-19. Lithium is a nutritional supplement with antiviral properties. It can also prevent a cytokine storm, making it useful for COVID-19. The good thing about lithium is that it has yet to be well known, thus it is not vilified like ivermectin or hydroxychloroquine. Being over the counter makes it easily accessible. This video will serve as an introduction to lithium and its effect on COVID-19 and possibly long COVID. Lithium is one of the first three elements after the Big Bang. Here is lithium in the periodic table. It is under hydrogen. Aside from its use as a battery, doctors commonly prescribe lithium for mania and manic depressive or bipolar disorder. Many doctors will tell you that it has a narrow therapeutic window, and meaning it can cause toxic side effects like nephrogenic diabetes insipidus, which is a condition where a person will just drink a lot of water and urinate a lot of water. However, the dose for mania or bipolar disorder is 600 to 1800 milligrams a day, whereas nutritional supplementation for lithium is only 1 to 5 milligrams a day. My interest in lithium started when I listened to the interview of Dr. Michael Nehls by Mike Adams on Brighton. In the interview, I heard him talk about the positive effects of lithium ion on the brain, which are: it protects against the development of neurodegenerative diseases like Alzheimer's disease, also Huntington's disease and Parkinson's disease. Lithium can promote the production of new brain cells. Yes, that's correct. Even if we are adults, we can still make new brain cells. And lithium can also promote neuronal autophagy. Autophagy is when the brain recycles old cells, precancerous cells, or damaged cells to make new nerve cells. Dr. Nehls recommended a dose of 1 milligram of lithium a day. So I searched Amazon if it's available, and I found out that it's available in 1 and 5 milligram tablets. Actually, since then, I've started taking lithium once a day. As always, whenever I hear a medical claim like this, I research and was able to verify what Dr. Nehls said about the album. Dr. Nehls wrote The Indoctrinated Brain, and it is available in Amazon. I will provide an affiliate link below. Lithium and COVID-19. In August 2020, the journal Frontiers of Pharmacology published research conducted in Spain on 6 people with COVID-19 who were given lithium. The patients did much better because of improved inflammatory activity and immune response in these patients. The author's next step was to conduct a randomized controlled trial on 15 patients given 200 milligrams of lithium carbonate every 12 hours. The control group consisted of 15 patients who received a steroid called dexamethasone. It is a strong, or you might say, hospital-grade anti-inflammatory for 7 to 10 days. The study group consisted of people who were at risk for severe COVID-19 like hypertension, dyslipidemia, and obesity. This table compares the two groups, the control group and the lithium group, and you can see that both sides have either diabetes, hypertension, obesity, which is the most important risk factor, dyslipidemia, and others like depression, asthma, cardiomyopathy, myalgias, and osteoporosis. Comparison of the two groups tells us that this study actually replicates what the actual conditions in a real-life situation where people with diabetes and who are overweight and obese get sick with COVID-19. The result is that in the lithium group, everybody got better. Their hospital stay was shorter, 6.47 days. This is the hospital stay of the lithium group. And this is the hospital stay of the dexamethasone group, and you can see it's about 20, almost double the hospital stay. 2 people out of 15 in the control group were admitted to the intensive care unit, while there was none in the lithium group. 1 patient in the dexamethasone or control group died, whereas there were no deaths in the lithium group. One characteristic of COVID-19 is that most patients develop lymphopenia, or a decrease in their lymphocytes. Now, lymphocytes are a type of white blood cell that is very important in fighting viral infections like the SARS-CoV-2 infection or COVID-19. So, what they did is that they measured the lymphocytes of the lithium group. See here, this is one that is in red, and this is the lymphocyte levels of the control group, or the ones in the dexamethasone group. So what it shows here is that during the days that they were sick or hospitalized, and even after admission, because most of this control group were discharged in 6 days, some of them, their lymphocytes level were high enough, higher compared to the control group, and that's one reason why they were able to fight infection better. The other thing that they measured are the inflammatory cytokines. Now, inflammatory cytokines are needed to fight an infection. However, if there's too much inflammatory cytokines, then you develop what you call a cytokine storm. And this is the second part of COVID-19, where people get very sick, and that's what gets them admitted to the intensive care unit. So, on this figure, again, the control group is in black, the lithium group is in red, and these are divided. These are different kinds of cytokines: PD-L1, interferon gamma, IP-10, STIM, IL-2, and so on and so forth. And what it shows here is that among the lithium group, when they had on the day of admission to the hospital, their inflammatory cytokines are higher than the control group. See that? Now, that's needed because you want those inflammatory cytokines to fight the infection. Now, on day 3, they measured the cytokines again, compared both groups, and they found out that the inflammatory cytokines among the dexamethasone group are higher compared to the lithium group. Here. And what it means is that this is the reason why there are less ICU admissions, and that's why they have less or shorter hospital stays. Even on the day of discharge, the inflammatory cytokines among the lithium group is lower. But that doesn't mean that it was not enough, but it was not enough to fight the virus, but it was just at the right amount to control the virus and for the rest of the body's immune system to get rid of the virus. This table shows us the neurological long-term effects 1 month after hospitalization from COVID-19. You can see here that among the lithium group, 7 out of 15 continued to have symptoms. Symptoms are like brain fog, headache, muscle pain, brain fog, weakness, shortness of breath. One has no sense of smell, shortness of breath, migraine, weakness, shortness of breath. In the control group, the group that received the standardized treatment, which is the dexamethasone, one patient was still in the ICU. Actually, to make it short, there's 10 out of 15, or there's more people in the control group who had persistent symptoms after COVID-19 1 month after discharge. And actually, some of them are worse, like reduced mobility. There's more people who had asthenia is weakness, muscle pain, shortness of breath. There's like 3 of them, brain fog, and there's one here who got admitted to the ICU and died. Lithium has antiviral properties. Previous studies have shown that lithium chloride can inhibit bird flu coronavirus infections. It can stop the replication of herpes simplex virus and a porcine epidemic diarrhea virus. And it can stop the growth, or it has antiviral effect on canine parvovirus. A study back in 1981 showed that lithium can influence the growth of white blood cells by affecting the stem cells, which are the source of the white blood cells. So this explains why the previous graph showed that while they were sick, the people who had lithium had continued higher amounts of lymphocytes compared to those who received the dexamethasone. One reason that lithium can affect the pro-inflammatory cytokines is that it can inhibit GSK3 inhibition. Back in June 2020, kind of in the beginning of the pandemic, Christopher Rudd from the University of Montreal and McGill University hypothesized that repurposing of low-cost inhibitors of GSK3, such as lithium, will limit SARS-CoV-2 infection by both reducing viral replication and potentiating the immune response against the virus. And it proves that he is correct. So let's go back to this table where it shows that the people with COVID-19 that are on lithium had less urologic effects after discharge. Does it mean that lithium can be useful in long COVID symptoms? One urologist from the University of Buffalo thinks so. His name is Dr. Thomas J. Guttuso Jr. from the Department of Urology. So this is an article about from UB Now. It's from the University of Buffalo community, which is in my neck of the woods. And here's what he said. Improvement in a matter of days. I was shocked when the patient saw improvement within a matter of days, says Guttuso. Since then, he discovered that during the pandemic, researchers in Spain had published findings revealing that patients who were already taking lithium for bipolar disorders, who became acutely infected and hospitalized with COVID-19, had better outcomes than those not taking lithium. Those findings and the report from his own patients were intriguing, and when other physicians heard of Guttuso's success, they began referring their patients with long COVID to him. Eventually, he was treating 10 additional long COVID patients with low-dose lithium. 9 saw improvement from lithium, none experienced side effects. I just kept hearing the same story, that within days they were noticing satisfactory benefits, says Guttuso. Some said their symptoms didn't come back after they stopped taking lithium, while others needed to keep taking it. Jennifer Stewart of East Amherst was one of them. She had a mild COVID-19 infection in January 2022 marked by few symptoms aside from brain fog and intense fatigue, which didn't let up even months later. I'm a really energetic person. I never nap. And here I was taking naps in the middle of the day, she recalls. I even slept through a Bills game I was going to watch on TV. That's how bad it was. Finally, in July, she went to see Guttuso. After a thorough exam, he mentioned the outcomes he was seeing with his long COVID patients on lithium. She was surprised to hear that lithium, which she knew was prescribed for psychiatric conditions, might help. Dr. Guttuso explained to me it's such a low dose. It's like the equivalent of taking a mineral like calcium or magnesium, says Stewart. I asked him how long it typically takes to kick in, and he said about 4 days. I thought, wow, that's fast. Within 2 days, I realized, holy cow, I don't need to take a nap, she says. That strong need for a nap had disappeared. A few weeks later, she stopped taking lithium. Her symptoms have not returned. Asked what advice she would give for others with long COVID, Stewart didn't hesitate. I'd say, oh my gosh, why on earth wouldn't you enroll in this trial, she says. My symptoms are completely gone. So, Dr. Guttuso is currently, probably already finished with this clinical trial. And this trial is about the effects of lithium therapy on long COVID symptoms. Actually, the study was already completed last year, so we're just waiting for the results and study. Incidentally, our Dr. Gutosa also published a book. Like Dr. Nehls, he published this book called The Promise of Lithium, and it is also available in Amazon with 4.6 ratings. I will provide another affiliate link for this book at the bottom of this video. So this is where I end on the lithium and COVID-19 and long COVID. I would like to thank all my supporters who have donated. And if you can afford to buy me a coffee or two, that will be greatly appreciated. Thank you and have a great day.